The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to the CIWM Health and Safety Campaign webinar. I'm Gemma Burney, Marketing Manager here at CIWM, and I'll be your host for today's webinar. I'd like to point out that although your microphones are muted, you're still able to ask questions by typing these into the question box on the bottom of the grey dashboard on your screen. You're encouraged to do this at any point throughout the webinar, and your questions are not public, so they can only be seen by the organisers. If you manage to minimize or lose your webinar presentation screen at any time, just click the blue flower on your taskbar at the bottom of your monitor to make it reappear. The session is being recorded, and a link to the recording will be shared with you via follow-up email around this time tomorrow. So don't worry about trying to take lots of notes, as you will also be able to revisit the slides as well as hear the presentation at your leisure. If, after this webinar, anyone feels that they need more detailed information on the webinar topic, we'll be happy to provide further details, and the organisers' contact information will be on your follow-up email. Audience questions will be answered after each presentation during the webinar. This will give you a chance to type them into the question box as you think of them. Do submit your typed questions throughout rather than waiting until the end so that you don't miss out on your question being asked. We will endeavour to answer as many questions as the time allows, but may not be able to get to them all, depending on how many were asked. Throughout the webinar, you will be asked for your opinions in the form of multiple choice polls. When a question comes up on your screen, you'll have approximately 30 to 40 seconds to tick the answer you want to make, and then click Submit. At the end of the webinar, a very brief multiple choice survey will pop up when you log out. Please do take a couple of minutes to tell us what you think, as your views are very important to us. Remember, this is an audience participation webinar, and your typed questions are welcome throughout. I'm now going to hand you over to Toni Gladding for our first presentation. Toni Gladding, Secretary, WISH and Chair of the CIWM Health and Safety Special Interest Group. And I'll hand you over to Toni now. So before we start, we have a quick question for the audience. Who is responsible for health and safety in my workplace? So please select one of the following answers: me and my co-workers, my line manager or supervisor, the CEO or MD of the company, or everybody. Okay, so we have the results from that question, and the majority of answers, 98%, have said everybody is responsible for health and safety in the workplace. Toni, do you have anything to add on that question?
Good morning, everybody. I don't have anything to add. It's a question that we asked last time, and I'm pleased to say that most people realise that health and safety is everybody's responsibility. So I'm pleased about that. Okay, so I think now that we will go into the webinar itself. We've already done the question. So basically, today we wanted to talk more about WISH and the work of the CIWM Health and Safety Special Interest Group. I'm Toni Gladding. I'm a senior lecturer at the Open University, but I'm also secretary to the Waste Industry Safety and Health Group, and I also chair the CIWM Special Interest Group. So by all means, please do send me questions on those two groups. Okay, so I want to talk very briefly about some of the history of WISH. WISH was begun in the early 2000s, but it's reorganized itself every 2 to 3 years in light of the various health and safety issues of the day. Sad to say, I suppose, that the waste industry does not have a great health and safety performance, which Ceri, I know, will dwell on a little bit later. So basically what we try and do every 2 to 3 years is have a national meeting and refocus on the priorities going forward. And I expect that we will be doing another one of those next year, so keep an eye out for that. Other wish work that we do is we obviously produce various parts of guidance on our website, which I will direct you to in a moment. And we also have a program of things that we are looking forward to releasing late this year, which I will also get back to shortly. So the other thing to mention is the role of the CIWM Special Interest Group. That has also been going for a few years. We relaunched it a little bit in 2017. It supports the activities of WISH. Many of the members are also members of WISH working groups, which I will come back to. We also support the People in Binge initiative and the Driving Recklessly on Pavements. But the thing that we really want to push over the next year is personal responsibility for health and safety, because the industry does have an issue and it's not rocket science what's happening, and we hope that by encouraging everybody to have a personal responsibility for their workplace, that we can improve the culture and the performance of the industry. So let's think about the industry for a moment. What has changed? Well, since even I joined the industry, which was in the early 1990s, a lot of things have changed. We obviously are segregating the waste stream now more than we ever were. We have recycling targets, we've got new technology, but these are not the reasons for the poor performance of the industry. Unfortunately, it's the same old injuries, the same issues, the same things that you would get with transport and machinery. It's not rocket science. So really, we might have some new risks that we have to think about, for instance, things like bioaerosols from segregated organic waste streams, but actually that we still have a lot of traditional problems with kit, with transport, with slips, trips and falls, etc. So that's really what we wanted to emphasise. It's not rocket science here. And our guidance with WISH is actually partly on the new, but partly on those traditional issues. So at this point, I just want to highlight, if you don't know already, the WISH Forum website, which is at wishforum.org.uk. We still have some pages on the HSC website, and HSC and us are in partnership over this issue with the waste industry. However, this particular website enables us to produce various bits of guidance and more up-to-date information a lot quicker. It's supported by CIWM, and it's worth a visit to look at the guidance and the working groups if you haven't done already. Okay, so what does WISH actually do? Well, the backbone of WISH actually is to produce guidance. So what separates this guidance from others? Well, basically, it's not, we haven't parachuted in health and safety people here. This is people that work in the industry, that know the practical issues that operators have to face, and it's written by operators for operators. But having said that, there are a few things to highlight. The first is it's not merely to pass muster, as it were. It's not merely to comply with legislation. It's best practice. But we also encourage hints, tips, advice, case studies, and updated knowledge as things progress. It's worth pointing out at this point, you've got a few titles there on the right of that slide. We're very pleased with some of those. For instance, the fire risk at waste management sites has been taken up internationally as far away as Australia. So although we've said that the UK is not great for health and safety and waste, trust me, we are leading the way in the world on trying to change that. So we are, our guidance is actually getting disseminated not only throughout the UK, but throughout Europe and beyond. So this guidance is recognised pretty much worldwide as being an excellent industry standard. And I'll just mention we've got some new guidance coming out this year. One is called Waste 04, which is the safe waste and recycling at collection services. That's due out later this year. We've got some new guidance on health surveillance in the waste industry and on biosols, which we hope will all come out by the end of the year. Okay, so what are we doing now? Well, we'd encourage people to join our working groups, which are open to all. It's not an exclusive club, WISH. We are always really pleased to have new people contribute, whether they are interested in small to medium-sized enterprises, safe workplaces, healthy workplaces, or competence or whatever. So these are the 5 main groups, but if you go to the WISH website and click on working groups, you'll see those broken down into topics. And by all means, if you can contribute, send us an email on info@wish, and we will basically get you in. Okay, so we've upped our safety standards. Basically, WISH is really established as a forum to establish and share best practice to improve the safety performance of the industry, which frankly there is a lot of room to do, to help develop the competence of those who work in the industry. And at this point I just must mention the excellent work of the Switch Forum, which are our Scottish compatriots who have developed an excellent competency framework, which is worth a look. And we want to also improve the perception of the waste industry, because frankly it's not viewed as a great career option at present, and obviously we want the best people, so we want to improve that. At this point I also want to mention some of the research that the HSE carries out. This report was published this year, and it was basically looking at the common human factors underlying worker fatalities in the waste and recycling industry. It's more or less we have 39 odd fatalities in the last 5 years, which is pretty atrocious. And as I mentioned earlier, these are not because of weird and wonderful ways that the waste industry works. These are fairly standard things that we really should be doing as an industry. There's a handout, by the way, that explains a little bit more about this report, but I would encourage you to Google the report and read the front or the abstract to try and get an idea of the things that are happening in the industry. This particular research looked at 18 fatal industry accidents in a lot of details, and it basically came down to the same old things: fundamental issues around how kit and how it is used, machinery, organisational issues around poor safety culture, and individual actions. In other words, people doing daft things. It's not because necessarily they mean to do daft things, but because, you know, pressures of process or they're trying to get things done. Generally, it's people trying to be helpful, trying to get their work done, and unfortunately they cut corners. So I know that 2 major conclusions out of this report is: the first is that we have to look at equipment factors, including design, use and maintenance, and safety management systems. And I'm sure we can talk about those further if we need to later. Okay, so to come back to one of the reasons for the webinar, which is our personal responsibility campaign. The Health and Safety Special Interest Group is committed via CIWM to try and improve the health and safety and welfare performance of the industry. What do we mean though by personal responsibility? Well, we've already been through the poll question. We know that everyone is responsible for health and safety. And that's your own health and safety and those of others, and also helping your employer to meet their legal requirements. That's the sort of formal side of personal responsibility. But I also want you to think for a moment over what actually happens. If there is an incident, yes, your company could end up in court, but perhaps not what everybody realises is that you can end up in court yourself personally. workers do get prosecuted. And if you look in your web links later, you will see a video on the HSE website. This is unfortunately an incident where a driver was sentenced to 6 months in custody, suspended for 2 years, and ordered to undertake 40 hours of unpaid work. He was also ordered to pay costs of £500 for this incident. And basically, we haven't got the full video because it's a little bit laggy. But in effect, what happened is he drove recklessly this piece of machinery in the waste in the yard, and he crushed a worker between the door and the machine, and he was seriously injured. And as a result, that individual who was driving that machine ended up in court. Okay. So to conclude, what are we asking as part of our personal health and safety campaign? Well, we want you to ask 10 questions of yourself, which I hope are going to be published in next week's CIWM magazine. And it's things like, do I know who's responsible for health and safety? Whose safety am I responsible for? Can I approach management if I see something dangerous freely without issue? Have I had the right training? Have all my co-workers had the right training? Do I know what the main risks are of my job? We're planning to do monthly themes around this campaign, and I do know that there are a couple of other webinars planned on specialist subjects such as lock-off. So that concludes my part of the presentation. I think that we are now going to go to a question.
So our next poll question for the audience. Wish is about to draw up a next list of urgent topics. Which of these do you think should be at the top of the list? Please select one. Transport, machinery, health issues, fatalities, or a passport scheme for waste sites and facilities. Just to repeat that, Wish is about to draw up a next list of urgent topics. Which of these do you think should be at the top of the list? Please select one of the following answers. Transport, machinery, health issues, fatalities, or a passport scheme for waste sites and/or facilities. Thank you everyone for your votes, and we can see that fatalities has the highest scoring here with 30% of you voting that that should be in the next list of urgent topics, followed by machinery. Toni, do you have any thoughts on that question?
Yeah, I think fatalities is obviously a headline thing because of what they are and of the reasons that they happen. We will be looking at various issues to do with that, I think, within Wish. And actually, the whole personal responsibility campaign is partly born out of the fatalities report because it is quite evident that actually there is a cultural issue in the waste industry that we need to tackle in order to affect change. In other words, what I was talking about earlier about people taking shortcuts and trying to get things done, we have to take a step back from that and encourage people to really think about their safety before they do these kinds of things, because they are very normal, well, simple things that people are doing that are actually resulting in terrible outcomes, and they don't always realize that the possible outcomes from the actions they take.
Thanks, Toni, for sharing your thoughts on that question, and thanks also for your presentation. We're now going to move on to some questions for Toni. So the first question comes to us from someone who asks, I was a chartered member of CIWM, but now I'm with IOSH. Is there a danger of IOSH, CIWM and HSE doing the same job or worse, different jobs, or is that why Wish exists?
I would say it's exactly why Wish does exist. We are in partnership with HSE, and I know that there are some links VIOSH, and we're all tackling different subjects in the same industry. And you've got to remember, this is a huge industry. We're not just talking about household waste collection here, we're talking about commercial collections, we're talking about scrap yards, we're talking about batteries, we're talking about there's a huge amount to cover. And frankly, the more organisations that work towards the improvement of the industry, the better, as far as I'm concerned.
Thanks, Toni. We now have a couple of questions specifically about CIWM's Health and Safety SIG. So the first question is, how can I become involved with the CIWM Health and Safety Special Interest Group?
You can send an email to CIWM and they will connect you up with a lady called Mynard, who is managing the group. So if you put it for her attention, then you can be sure to be linked to the group.
Thanks, Toni. And the second question relating to that is, what are the monthly topics that will be covered?
So we've got a few things planned. One is definitely machinery, one is transport. We will probably do something around the culture of the industry. We will do hygiene and respiratory issues one month as well. So hopefully the whole campaign will be published in the next month or so.
Fantastic. Thank you, Toni, and thank you very much to our audience for the questions that you've submitted so far. Please do continue to submit your questions throughout the remainder of the webinar. Just something to draw your attention to, you might have noticed in one of Toni's slides that she referenced a handout. You can find all of the handouts available to download from the handout box on your dashboard now. So you can see that in the grey box on your webinar dashboard. And there's also a list of web links for documents and videos which can be found in the handouts section as well. We're now going to move on to our next presentation, which comes from Ceri Beynon, HM Acting Principal Inspector at HSE, and he's going to share his presentation, HSE Update, Waste and Recycling Industry. Over to you, Ceri. Ceri, we're having some problems hearing you. Are you there?
Good morning. Hopefully you can all hear me now. Apologies for a slight IT problem there. My name is Ceri Beynon. I've been asked to speak to you today in my capacity at the moment as the acting head of HSE's Waste and Recycling team. And that's a team within our engagement and policy division that does a dual role of not only liaising with the waste and recycling industry as key stakeholders, duty holders, and also providing support to my colleagues throughout HSE. My presentation today will cover 3 parts. Firstly, we should be looking at the background to health safety, and I think we should start off on a positive and say overall, Great Britain has one of the best health and safety records in the world, and sometimes we lose focus on that by always concentrating on the negatives. You should remember that we have got an exceptional record out there, but that's not to say that performance cannot be improved. For instance, with workers, we can always get healthier and safer workplaces. Businesses, we can look at improving productivity and innovation. And in society, we can reduce the £14 billion impact of work-related injury and ill health. The first question we've posed concerns the industry sectors, and of the 19, how many of those does HSE classify as high risk?
Okay, everyone, if you could please select one of the answer options from the list, the answer options being 6, 10, 13 or 19. Thank you everyone for your answers, and we can see from the results that 6 was the most selected answer, with 43% of you saying that there are 6 industry sectors that the HSE classifies as high risk. Ceri, do you have any thoughts on that?
Well, it leads into the next slide, which basically will confirm gold stars all round. There are 6 sectors prescribed as, or we designate as high risk. These are the ones that where we see the health and safety challenges are the greatest, and where we believe our interventions can have the biggest impact. And as a result, we concentrate the majority of our elective resources in these areas. So as you can see, construction, agriculture, manufacturing, public services, logistics and transport, and waste and recycling. So the question I often get asked is, why is waste and recycling a high-risk sector? Basically, because there's too many deaths. As Toni alluded to earlier, there's been 39 fatal injuries to workers over the past 5 years, and that includes 14 in 2016-17, 11 fatal injuries to members of the public, and that overall gives a fatal injury rate of 6.8% per 100,000 workers. That's 15 times the all industry rate and 3 times the construction sector rate. Additionally, there's too many injuries. 5% of workers in the waste and recycle industry are injured in non-fatal incidents annually. That's 5,000 non-fatal injuries a year, and that's 2 times the whole industry average. And finally, ill health. Again, 5% of workers believe that they suffered an illness that they believe to be work-related. And again, that's 6,000 people each year. And that gives an elevated rate compared to the all industry averages. So what is the HSE doing about that? Well, as well as the health and safety strategy for Great Britain that was launched a couple of years ago, help Great Britain work well, HSE has also published a series of sector plans and health priority plans. All 19 of the sectors have produced these, and they're available on our website. And I think there's a link into the handout section on those. What you'll see with that is HSE is attempting to effect change by directing our resources where the risk is greatest, as in the high-risk sectors we talked about earlier, and engaging and collaborating with others. CIWM as today, as Toni said, we're very active members of WISH. We also liaise with a lot of industry bodies such as BMRA, BVSF, VRA, the REA, lots of acronyms, ADBA, LAWS, LARAC, UROX, CHEM, and also co-regulators. We'd work very closely with the Environment Agency, NRW and SEPA to try and target together where we can affect the change. So one of these things we do is annual inspection campaigns, and one of those last year concentrated on the waste and recycling industry and was undertaken between October and December 2017. This time that campaign targeted the whole of the waste and recycling industry and all the subsectors, whereas in previous years we may have concentrated on a specific activity or process such as end-of-life vehicles or waste transfer stations that accept asbestos. This time, the campaign focused on the actual activities at those sites, in particular workplace transport and machinery. However, our inspectors also looked at all other topics and did a full inspection. So they would have looked at health topics such as occupational lung disease, noise, musculoskeletal disorders, as well as structural safety and welfare. I think we have a question again next.
So the next question is, was your organisation facility inspected during the last campaign? Please select one of the following answers: yes, no, or don't know. Thank you, everyone. So we can see that there is an even split between those who answered yes and those who answered no, both with 39% and then 22% saying that they don't know. Any thoughts on this, Ceri?
The figures, the one that stands out for me is the don't know. It'd be interesting to find out why that might be. It might be because you're in a large company that with many sites, and as such you may not know. But as such, what we would expect is with an inspection of any organisation, especially if it's a multi-site, if any lessons are learned from that site, they should be disseminated across the other sites as well. So maybe that's something you need to pick up with your line managers or the management chain, just to see if there's any reason that information hasn't been shared.
Okay, and just a quick reminder to our audience today, don't forget that you can ask questions at any point throughout the webinar today. Please don't wait until the end, as we may miss the opportunity to get your question asked.
With regard to the inspection campaign, 613 inspections were undertaken within that 3-month period. And as you can see on the figures there, of those, 296 notification of contraventions were served. That means at 48% of those inspections, our inspectors identified a significant material breach that needed them to take action or require their duty holders to take remedial action. We served 71 prohibition notices, 305 improvement notices, and 1 employer's liability compulsory insurance notice. 35% of the notices related to transport, and transport also featured in 277 of the notifications. So as I said in the previous slide, we served 296 of those notices. So that means 94% of those notifications included transport of some kind or issues regarding transport. Similarly, 25% of notices related to machinery, and 184 NOx featured machinery. That equates to 62%. So as you can see, those topics were highlighted for a reason and borne out. Apologies if some of you have already seen some of the photos that I'll be shown in this. These are all from last year's campaign and just illustrate the kind of things that our inspectors came across. The first one is a simple workplace transport. That individual unfortunately has to work in that area. The machinery is moving in and around, and a prohibition notice was served because there was no safe refuge for that worker. The next one just illustrates a guarding deficiency where there's a clear access point to the nip point in that conveyor. What's not as clear from that photograph is that you could also reach over and underneath that fixed guard. Normally that would have been a prohibition notice, but that machine was actually offline at the time of the inspection, and as such the duty holder rectified that guard deficiency immediately, so it was downgraded just to a material breach and a notification of contravention. This one's a bit more interesting in the fact that that's a fully interlocked enclosure to prevent access to a maintenance platform on a baler once it's operated. However, the step ladder was needed, although that small ladder was also needed to gain access, and so the maintenance team had hooked it on the outside, thereby enabling an individual to climb over and defeat basically that interlock. That also would have been a prohibition notice, except for the fact that they immediately removed the ladder and replaced it with a fold-away ladder that they'd relocated inside the enclosure, so immediately reverted the issue. Other main issues that came out of our inspection campaign: 309 notices related to safety, 32 to health, which included 25 for occupational lung disorder issues. 30 notices were for welfare and 5 for management. Just another couple of quick stills that come out of it. An improvement notice. Welfare, it's very disappointing in this day and age that we still found that our inspectors had to serve 30 notices for welfare. Broken and unclean toilets shouldn't be really seen in this day and age. And structural stability is always a core topic, especially following the multiple fatality incident the year before last. So what we'd always ask is that wall, that bay wall, is that load bearing? Is it not load bearing? The back building, is that load bearing? Do they know what's in the capacity, the tonnage within that area? Is it correct? Are they breaching the environment, the EA or NRW or SEPA permit for that site? Additionally, this also reminds me to mention the fact that the WISH working group as on the safer workplaces has established a subgroup that's working on bay wall safety. So if anyone would like to get involved in that, please contact WISH. So the key message that came out was safety remains the key issue at waste and recycling sites, but health is also a crucial topic for us, and we mustn't lose focus on that. It was therefore decided that we would repeat the campaign this year. So basically, in 2018-19 work year, and in particular between October and December this year, HSE will be undertaking a 4-stage inspection campaign. The main thrust of that is that our inspectors will be undertaking around 400 visits across England, Scotland and Wales, and that can be any site involved in any of the waste and recycling activities. Though I should say there are a couple of topics that we will not be prioritising, such as domestic collections or household waste recycling centres, because we've spent a lot of time and effort in the last couple of years concentrating on that. The majority of our inspections will be unannounced, and just to alert you that there could be more than one inspector turning up at these inspections. There's nothing onerous about that. The second element relates to our national inspection, national lead inspector scheme. This is where 14 companies that have either the large companies or they have multi-sites or a key role have signed up to the NLI scheme with HSE, and with the aim of not only improving consistency and communication within our organisation, but also enabling us to tap into that resource and get fresh ideas and thoughts and ideas to take safety forward from what the industry actually want. And that ties in a lot with the Help Great Britain Work Well strategy, where the focus is for industry to take ownership of its health and safety, which also ties into the CIWM campaign. With this element, no NLI company will have more than 10 visits, but saying that, not all of them will have 10 site visits. That's purely because some of those organisations may concentrate their resources on domestic collections and so forth, or they might be in one particular area of the country, and as such, we will not seek out visits for the sake of it. And that will then be complemented by a final head office feedback visit by the NLI inspector from HSE together with a senior manager from HSE, which will feed back on the findings of up to the 10 visits that NLI has had. And finally, at the end of it, within the sector team will be reviewing the findings to look at, is there anything we can do to help shape the future of the NLI initiative. The third stage involves catalytic converter recycling, and this is where we've selected 15 sites that we know recycle catalytic converters, and that is they physically recycle it and don't just store catalytic converters for forward shipping. The main thrust of this is to assess the understanding and control of refractory ceramic fibre, RCF, and other dusts. RCF is currently classified as a Class 1B carcinogen, and can be found in some catalytic converters. Well, not all, and it is very difficult to identify if it contains RCF until they've actually cut the can open. We've done a couple of visits so far and standards have been mixed, hence we are doing a more concentrated campaign to try and identify what the trends are. Bear in mind as well, when our inspectors arrive, they will be undertaking a full inspection of the site, not just where you're decanning. So they'll also be looking at all the other general issues, and they'll also be accompanied by one of our occupational hygiene specialists, and that's due to the nature of what we're looking at. So they'll be there to not only give advice and guidance on the dust control and RCF control, but to provide support to the duty holder as well. And the final element is an evaluation element. 100 sites will be visited, and these are all sites that we visited within the last 2 years. They've been randomly selected and will have the previous level of compliance is pretty much irrelevant. So they'll range from sites that were found to have good levels of compliance through to sites that had significant non-compliance. The reason we're doing this is to establish if there's been sustained compliance following that inspection. And this is all feeding then to the overall HSE procedures to assess, are our inspections still effective, and are we targeting the correct places? So finally, I've been asked to just give a quick overview of what you can expect from an HSE inspection. HSE inspections tend to be unannounced because what we need to see is what's actually going on out there. There usually is only one inspector, but there can be more than one. There could be a specialist, such as what I've just mentioned with the hygiene specialist, but also there could be a trainee inspector with them, and also the line manager could be there, or sometimes we do it with trade unions. We try to encourage our inspectors to joint visit with colleagues from environmental regulators. It's not always possible due to the different ways in which we work, but whatever we can, we try and push that. But the key message is HSE inspectors are not trying to catch anyone out. During inspection, an inspector will speak to the relevant people, and that could be managers, supervisors, workers, employee representatives. They'll observe workplace activities and conditions. They'll assess relevant documents such as LOLA certs, safe systems of work, risk assessments. They'll also check whether the risk controls are actually effective, and all of that will lead to them identifying if there's been any breaches of health and safety legislation, and if there have been, then they will consider what the appropriate enforcement level will be. An inspector has a range of inspection powers, verbal and written. There's notification of contraventions, which are the name of the letter you receive, improvement notices and prohibition notices, which standardize and specify in regards to improvement notices, specify an actual period in which you have to take the remedial action. Prohibition notices where the risk is so high, there's an imminent risk of personal health injury or ill health, and you have to cease that operation or activity immediately through to prosecution. And if you want more information on there, there's lots of links on the HSE website that will explain. Fee for intervention, FFI is more commonly known, and this applies whenever there's been a material breach of health and safety. So a lot of people were asking material breaches, and it's basically something which an inspector considers serious enough to formally write to the business about, and which requires the action by that duty holder to take to rectify that material breach. FFI applies to the self-employed who put others at risk, employers, public and limited companies, general, limited and limited liability partnerships, as well as Crown and public bodies. And HSE will seek to recover all costs associated with that intervention. So it is not only just the site visit, it is also any time that the inspector takes preparing reports or letters, getting specialist advice, talking to you after the visit, talking to your workers, and then also the assessing of compliance. And bear in mind that the FFI rate is currently £129 per hour. But to leave you on a positive, or as best as I can with it, is that if you bear in mind that duty holders who comply with the law will not be charged FFI. If an inspector only gives advice, whether that be written or verbal, FFI will not apply. And therefore, if you don't break the law, you won't pay anything. Thank you. And if there are any questions.
Thank you very much, Ceri, for your presentation, and we'll move on now to some questions from our audience. So the first question is, will the HSE be having a communication campaign towards the waste industry before October, highlighting the targeted inspections?
There will be some information going out with regards to if you're signed up to HSE's e-bulletins and Twitter, there'll be messages out. It won't be to the extent of the campaigns we had last year. Last year was a bit of a pilot for HSE to judge the effectiveness of enhanced media campaigns, and as such, there's also other industries that have got significant campaigns on this year, so the resources are spread, so somebody else will be benefiting from that. We will, however, be putting out the Twitter notifications, the e-bulletin, and we'll also be liaising with other bodies to see if they can raise awareness as well.
Thank you, Ceri. Our next question is that surface mining and quarrying was not included in the 6 high-risk options in the question that we asked. Is there any particular reason why not?
I'm probably not the correct person to answer that. That's probably a question that you could submit to HSE as an FOI. These decisions to what the high-risk sectors are depends on a lot of factors. I've concentrated today on the high injury and accident incidence rates, but that's not to say that all 19 sectors don't have their unique problems and need attention and inspection. HSE has a finite amount of resource, such as any other regulatory body, and our senior management have to make hard decisions about where that can be targeted. So I don't have the exact answer for why quarries and surface mining was not included in that of the 6, but if you need that information, please contact HSE.
Thank you, Ceri. Our next question is, the fact that inspections didn't start until October meant that you didn't really address green waste, which makes up around 1/3 of the waste. This is many of the smells need for leachate collection. Is there a plan to redo the inspection campaign during the summer?
This is a targeted campaign. The HSE inspects throughout the year. So many of you in the industry will already have had inspections. What we tend to do is concentrate in on a period where the resources will come in. And again, it's linked to the previous question in that waste and recycling is just one of 19 sectors which demands an inspector's time. So as such, during the summer months, we also get a lot of calls to do agricultural visits and other types of inspection to other industries. The Q3 is when it was planned, which is a decision outside of our control. It'll move around different times of the year. Inspectors in the past, I personally have inspected many times sites involved in green waste. I know colleagues who have done it this year. So just because the Q3 inspection campaign is on this area doesn't mean that some inspections weren't carried out throughout the year.
Thanks, Ceri. Our next question is, the feedback from the campaign last year generally focused on the negative and enforcement. Will this year give away some positives?
It's always a catch-22. The nature of the beast with HSE is that our statistics will always mirror the negatives, unfortunately. How you quantify good practice and success is always a challenge, and is something that we try to promote, to be perfectly honest, within duty holders and stakeholders themselves. It's something, funny enough, that we are looking at within the Safer Workplaces group within WISH. And it's a proposal that was raised in the last meeting of why can we not put greater emphasis on positive recording as opposed to negative. Hopefully that will change in the future. But as I said, at the moment, a lot of the data that HSE will receive, unfortunately, will identify the negative. I suppose you can always flip around the statistics I said at the start. So you could say that 52% of the sites we visited were compliant. But historically, I often get asked the opposite question.
Thank you, Ceri. The next question that we have is, if I have 2 inspectors on site, is that double FFI?
No, is the answer. You will only be charged for both inspectors at a time if they are doing separate work. So for instance, it happens a lot in our hazardous installation visits where a specialist may go with one team and the inspector will be doing another piece of work independent of that person. With regard to our inspections, I off the top of my head, I can't see a situation where both parties will charge double for the same piece of work. However, that if you have any concerns when an inspector attends site with a specialist or another person, then you can always ask that question directly to that individual at the time and clarify. And also, if you do have any subject to FFI, there will be a breakdown of those costs that are being recouped, and you can query those if you do not agree with them.
Thank you, Ceri. We have another question relating to FFI, which is, will FFI apply to verbal advice?
No. It's a simple question. Verbal advice is free. I think I covered it in the presentation. Any advice, verbal or written, does not activate FFI.
Thanks, Ceri. The next question, do you have any figures as to how the clinical waste sector compares to other waste and recycling sectors in relation to injury rates?
I personally don't have that sort of breakdown. It's very difficult to get subsector industry data and to qualify. We often get asked this question about subsectors, and even comparing against industry to industry is very, very difficult. What we try to do is try to encourage those bodies involved specifically in those areas to try and see if they can benchmark against one another. It'll often come down to duty holders sharing data. It is extremely difficult for HSE to break that data down due to issues such as the standard industry coding, how things are recorded, interpretation of data. Our statistics team are very good and spend a lot of time and effort trying to get us the best information we can, but there are limitations to what they can actually do.
Thank you, Ceri. Thank you very much to our audience for all of your questions, and thank you, Ceri, for your presentation. So we're going to conclude with two questions for our audience. The first question is, were you aware of the new round of HSE inspections before seeing today's webinar advertised? Please select one of the following answers. Yes, no, or I thought they finished last year. Thank you everyone for your answers, and we can see that 64% of you weren't aware of the new round of HSE inspections before today's webinar. And a final question for our audience today. Do you know how to or feel confident in raising H&S or welfare issues or other serious urgent matters with management? Please select one of the following answers. Yes, no, or it depends. Okay, and we can see that 96% of you said that yes, you know how to or feel confident in raising health and safety or welfare issues with management. Ceri and Toni, do you have any comments on those two questions?
Well, for the first one, it's no surprise you didn't know there's a concentrated campaign coming. Bear in mind what I said earlier, HSE inspectors can turn up at a site at any time. So every year you should expect an inspection, but this year's target, this is the first part of raising awareness. So I'm not overly surprised that people didn't know or were unaware of the campaign.
I think I'm a little intrigued on who voted it depends. So I'm assuming it depends on the type of incident or the type of matter, which is a shame. That's obviously, well, luckily it's only a very small percentage, but hopefully that's one of the things we really want to get over in the campaign, that it's everybody from the people who are on the floor, as it were, right through to senior management.
I should say with the 4%, if you do feel there is an issue that you can't raise, then you should try and contact HSE and see if there's something we can get involved in.
Thank you very much. That brings us to the end of today's webinar. As promised, we have the contact details for both Toni and Ceri on the slide that you can see now. So please do feel free to get in contact with them. Thank you very much again to Toni Gladding and Ceri Beynon for your presentations today. And that just leaves me to thank our audience very much for taking part. And please don't forget to complete the brief pop-up survey when you leave. As we mentioned earlier, your views are very important to us. Thank you and goodbye.
Thanks.